So here we have the S10, the Resmed S10 unit, and we're going to kind of walk through setting it up. On the front here, you've got a little toggle and selection button, and then you've got a home button, which we'll kind of go over. If we do a turn to the side here, this is where your water chamber goes. So the water chamber has a little flap on the front here. Kind of lift that to open it in two. You'll be able to put your distilled water. It's distilled water only in the machine. It does have a max fill line and then some other guidelines for you here. You're going to fill it with distilled water. You're going to close it. And then you're going to slide it into the side of the machine here. And you do want a tight connection, so you do want to hear a little bit of a thunk so that it's got a nice tight seal on the inside there. If we turn to the other side, you have your filters here. So you'll open the little flap here and the filter is just going to sit in the door there. You're going to change this every 2 to 4 weeks. Even if it doesn't look dirty, change it at a minimum every 4 weeks. Don't wash it, just take it out, throw it away, place it back in there, and then close the door. So underneath this flap here, you have your SD card. So the SD card is a memory chip that saves all of the therapy data. You may be asked to bring this in either to HME or to your doctor's office. To take it out, you're just gonna press and it's gonna click and pop out there. It does go label side to the front to put back in, so you'll line it up, press to lock it into place, and then you're good to go. Now on the back here, you have your power connection. So it's just a simple power connection on the back. As soon as you plug this in, the machine does power on and is ready to start therapy. Now tubing connections, you have a couple of different options for your tubing here. First is going to be the heated tubing or the climate line tubing. Climate line tubing does have one end that specifically goes into the machine, so it has a little chip there. That chip needs to line up to the opening on the back here, so you're going to line that chip up and lock it into place. Now, the climate line tubing does change the menu options and the comfort settings, so we're going to go into the menu options, then we'll go back over the other tubing options in just a minute. So we're going to turn it all the way back around to the front here. And you'll be able to see that there are two options. You have My Options and Sleep Report. So the label that's lit up blue is what's being selected. You would use the little toggle here to change between the two. And then when you're ready to go into one, you just press down on the button there. And then this gets you into the comfort settings. So the first option there is going to be your ramp time. So your ramp time means that the machine is going to run at a lower pressure. Ideally until you're either used to it or asleep, and then it's going to go to therapy pressures. To change the setting, you're going to push the knob there to get into the menu, and then you'll toggle based on the minute setting that you want to set it at. It goes anywhere from 5 minutes to 45 minutes, or the feature is off. Now for the heated tubing, you have a climate control setting here that has either auto or manual. Auto means that the temperature is going to run at 80 degrees Fahrenheit and the humidity is going to be at a level of 4, which is right in the middle. If you turn it to manual, then you can actually adjust the settings yourself, which would be the next option there. So if we scroll down, you've got tube temperature, and that will be anywhere from 60 to 86, and so you would adjust this setting depending on your comfort. You can adjust this based on the season. You can adjust it based on the way you feel that night. It's purely for comfort. So finding the setting that you want and selecting it. And then next option down is humidity level. So again, humidity level is at a 4, which is right in the middle. So it's either off to 8. If you're not sure what humidity level you are going to run this at, then you're just going to start in the middle and then adjust based on how it felt that night before. If you wake up feeling the mouth is very dry, you can go up to a 5, try that for the next night and keep going. But if you wake up and feel like there's a lot of water in the tubing or a lot of water in your mask, then you can toggle down to 3. And again, this may change depending on the season. It does detect the ambient humidity in the room. So sometimes you may not change the setting, but the water usage on your chamber will change. And of course, the higher the setting there, the more water that you're using off your chamber. Now, this particular machine does also have a leak alert. Leak alert is just a tone that's going to play if it's detecting a high leak on the machine. And then you have your Smart Start option. Smart Start is just an auto start option. So when you have this feature turned on, you're simply going to put your mask on, take a big breath in, and the machine is going to detect that you're connected and it's going to start. The other option, if you do not use that feature, is you just use the start and stop button up here at the top. So when you're ready to start your therapy, you would push the button, and when you're ready to stop it, you would push the button. Now, there is a mask setting also in this menu. Mask setting is just going to be leak compensation, so you want to make sure this is set to the actual mask you're using. So a full face, nasal, or nasal pillows. There is a mask fit test that you can do on this machine, and that is something we recommend you do anytime you change your mask or adjust your headgear. It just runs the machine at a higher pressure to detect if there's any leaks. Now, it also has the warm-up feature. Warm-up just means that the heated plate's going to warm up prior to your usage. And then there is an airplane mode there. Airplane mode is going to turn off if this comes with a cellular chip in it. It's going to turn that off so that this is usable in an airplane. So you can always scroll all the way back up to the top to get out of it, or you can hit the home button, and that takes you back to the main screen there. Now, the other tubing option that you're going to have is going to be the non-heated tubing. So the non-heated tubing is the slimline tubing, and it has the same end on either side, so it doesn't matter which end plugs into the machine and which end plugs into your mask. This tubing also comes with an elbow option, a tubing elbow option. So this just allows it to have some mobility when it's connected to the machine. It has a big end and a small end, so the big end is going to go on the machine and the small end is going to go in your tubing. So again, small end, a big end there, and then the small end connects to your tubing. Now, like I mentioned before, this does change the climate control settings that you have. So we're going to go back into our options, and you'll see that you no longer have climate control as an option. You simply have humidity level. So it does still allow you to adjust the humidity level, but because it is a non-heated tubing, there is no tube temperature setting. Now, the last option that you're going to have for your S10 unit is going to be if your doctor has ordered an oxygen bleed-in for your machine. If you're using the non-heated tubing, you will need a U-adapt, which is just a connection, a little adapter that allows you to have an oxygen connection on here. And this would simply go between the elbow and the tubing. So you would put one end on the elbow there and then connect the tubing to the other end. And then this allows you to connect your oxygen tubing there to bleed it in. Now, if you're using the heated tubing, however, you do have a heated tubing option called an oxyline. Oxyline is going to look very similar to our climate line tubing, except it has a little connection at the end here that allows you to bleed in your oxygen. So it's going to work the same way. You have a chip that you're going to line up to where the chip goes in your machine. And then your oxygen tubing is going to connect to the end. Now, if you're using oxygen with your CPAP machine, there is a specific order that you need to turn everything on when you're ready to use it. You do want to start the CPAP machine before you start the concentrator. And then vice versa, when you are ready to take it off, you want to turn the concentrator off first and then the CPAP. That prevents buildup of oxygen in the machine. Now, as far as taking everything apart, the climate line tubing does require you to pinch either side of it before you pull the tubing out. It does have a little lock that does hold the tubing in there. The non-heated tubing is simply a rubber connection, so you just give a good little tug and it'll come out. The water chamber, to remove the water chamber, you're going to pinch the top and the bottom and you're going to pull straight out. It does have rubber connections on the inside there, so it is a tight fit. So you just want to make sure you give a nice little tug to get that out. All right, so you are going to want to Open this every morning, dump out any remaining water, and then let it tent to air dry. Don't use any sort of towel or paper to clean it. You also don't want any water sitting in there for long periods of time. Okay, I think that's it.